will be on hypertension in East Asian medicine. So hypertension is commonly known as high blood pressure. It's a high pressure of blood pushing against the walls of the blood vessel. A normal reading would be 180 millimeters of mercury, plus or minus 20. Risk factors include old age, lack of physical activity, genetics, obesity, and a high salt diet. Some demographic information. The WHO reported an estimation of 1.28 billion adults having hypertension, 21% having it under control, and 46 are unaware of the disease. One of the global targets for non-communicable diseases is to reduce the prevalence of hypertension by 32% between 2010 and 2030, as it is one of the most common premature deaths worldwide. So in the Western medicine approach to treat hypertension, usually oral medications and lifestyle modifications are implemented. Oral medications include ACE inhibitors, angiotensin receptor blockers, calcium channel blockers, thiazide diuretics, beta blockers, alpha blockers, centrally acting antihypertensives, vasodilators, and renin inhibitors. Lifestyle adjustments include diet, stress management, and regular exercise. In East Asian medicine, hypertension is seen as an imbalance and stagnation. The causes are usually liver yang rising, which is associated with emotional overload and stress, and kidney deficiency, which is associated with unhealthy lifestyle choices. So, liver yang rising and kidney deficiency can be either an excess or deficiency, which can cause the hypertension. So in excess, it is manifested as rising yang, which is caused by eating while working or being frustrated during mealtimes. This leads to an excess of liver qi and causes liver yang rising. Emotional imbalance, such as frustration, anger, and resentment, drives rebellious liver qi upwards, especially when suppressed over a long period of time. In addition, deficiency can be an underlying deficiency, typically of the yin or blood. This affects the flow and the blood of qi, which causes qi stagnation, disrupting the body's internal energy circulation. So when diagnosing hypertension in East Asian medicine, we use symptom recognition, pulse taking, and diagnosing to the tongue. So in symptoms of excess, there's usually deafness or tinnitus, headaches, and emotional outbursts. In deficiency, we can see blurred vision, insomnia, numbness and stiffness of the neck, shoulders, upper back, and knee muscles. When diagnosing to the tongue, when there is liver yang rising, the tongue might be pale, normal or red on the sides, and without coating. Whereas in kidney deficiency, the tongue would be red, no coating would be present, and in severe cases, the tongue might be cracked. When diagnosing to the pulse and there is liver yang rising, the pulse would be wiry, which is typically associated with stress or liver imbalances, reflecting tension or blockages in the energy flow. In kidney deficiency, the pulse might be floating, rapid, or empty. In floating pulse, it is superficial but strong when no pressure is applied, but disappears when pressure is applied. Rapid but weak pulse indicates yin energy, which allows yang to flare up, and empty pulse indicates qi deficiency. So when treating hypertension, the aim should be to bring the liver yang down, to move the blood, and to calm the mind by quietening rising yang and nourishing liver yin and blood. This can be achieved through herbal Chinese herbs, acupuncture, qigong, and lifestyle adjustments. Addressing unresolved emotions and handling physical triggers to restore balance in the body. This may include tonifying and reinforcing the organs which are affected by the deficiency or calming the hyperactivity. Data shows a controversy in using cupping. In a systematic review, it was seen to alleviate the symptoms but not directly treat the high blood pressure, whereas in another systematic review, cupping was effective in controlling hypertension. So when using acupuncture, liver 2 and gallbladder 32 can be used to bring the liver yang down. Liver 4 and liver 3 can be used to move the qi and blood. Gallbladder 40 and yang can alleviate headaches in the temporal region, which is a common symptom in hypertension. And kidney 1 and gallbladder 20 reduces the dizziness and brings the blood pressure down. Qigong is something that can also be implemented when treating patients with hypertension. It is a mind-body practice involving coordinated movements, deep breathing, and focused meditations to cultivate and balance the qi. It increases the healthy flow of qi throughout the body, helping it to heal itself. Therapeutic effects are seen when using qigong among individuals suffering with hypertension. As you can see in the diagram, over a span of 2 years, both the systolic and the diastolic a decrease was seen in the blood pressure. So in conclusion, results in acupuncture among individuals with hypertension are seen around 3 to 4 weeks. For a better effect, it can be combined with other therapies such as qigong, herbal medications, and lifestyle modifications. Additionally, this can also be combined with Western medicine as well as to treat both the blood pressure and to alleviate the symptoms for optimal effect. Thank you.